Hi, I'm Dr. Veronica Botova. I'm a naturopathic doctor. I have a private practice in Leduc, Alberta, and I treat a lot of different patients, including cancer. Cancer can be a very emotional and scary diagnosis for many patients. And I'm really happy when they choose this option because we've had some amazing results with cancer patients, and I'm just excited to share one of our stories. I have a patient here. Her name is Malgorzata, and she's going to share her story with breast cancer with us.
Oh, hello. My name is Malgorzata, and I was diagnosed with breast cancer in middle of May in 2018. And after this diagnosis, what they found a lump about 2 centimeters, approximately 2 centimeters in size, and then they decided to cut it out. So I went to see those doctors, and that's what the plan was. So I came to see Dr. Botova and consult because I was doing all kinds of what we were doing?
We're working on chelation.
Chelations, yeah, getting starting with like getting to a healthy living and looking after myself, and we were doing chelations, and then so I just did my routine testing, and they found that I had a lump in my left breast. So after they decided to cut it out, I just say, okay, that's fine, and just remove it. And then after consultation with Dr. Botova, we started the treatment, which was high dose of vitamin C, and we were doing it twice a week, right? And then high dosage of injection, ozone injection, So twice a week we were doing that. And then I changed my diet. Like when I found out, then I drastically changed my diet, and I was just eating basically plant-based diet, and I didn't touch any meat, and for like 2-3 months. And
what was the treatment that your oncologist was suggesting for you?
Okay, first of all, we went to they give me after surgery they checked that was the stage 2 cancer, because the lump already had some cells in
the lymph node.
In the lymph nodes, they went to the lymph node. So they wanted to do chemotherapy. They changed it. First of all, they were thinking to do a radiation, but when they found this is a stage 2 cancer, they wanted to do a chemotherapy, and they didn't recommend the radiation. So we had a meeting with oncologist at the hospital, and she told me all about the chemotherapy, all the side effects, and I told her, I said, like, look at me now, I'm pretty healthy. I came and I'm not very sick, so you're going to make me sick. How is this going to work? And I asked her, I was quite prepared for that, because I just took time. Don't let oncologists and any doctors, I beg you, rush you to any treatments. People get scared and they just rush, and they don't know what's going on, and they make a decision on a fear. So I was scared, but I said, no, I'm not going to get feared, because if my body created it, maybe the body can take it out. So, this is miracles happening, and there is possible treatments which I don't have to be sick from it.
That's right.
So the oncologist told me all the side effects and blah blah blah, and I said that okay, why don't you send? I know there is a test in Greek. I found out there is a test in Greek, and what they do, they take cancer and they put all the drugs on it, and they see which one works the best. And she said, oh, sorry, but we don't do that here. We just have a protocol, and we just load you with the drugs, and one of it is going to work. I said, how are you going to guarantee? And she said, well, we cannot guarantee. So I said, okay. Can I see, so I asked her, okay, so can I see the radiologist? Okay, she's here. So she came and she said, well, you refused the chemotherapy, so we have to do something, she says. We have to do something. So so radiologist. Okay, radiology. I said, well, is it going to have a side effects? Oh no, it's going to just go like this, she says. The radiation will go like that. It doesn't go deep. It doesn't touch your lungs. It doesn't touch your heart. And I said, oh. So I'm having an IV. I need to tell that because that was it. And I'm having IV here, and then Dr. Botova's husband, Dr. Louis, he's sitting and hooking me up to IV, and we talk, and he's just came from, I think he came from Vancouver or something. He has another office in Vancouver. So I'm talking, he's hooking me up, and I'm like, he says, don't worry, we're going to help you out, and everything's going to be fine. I said, but I have to go for radiation. He says, don't you dare ever think about it. You better go and do a research. I said, oh, okay. So he got me scared, and I said, okay. So I started researching, and for a fact, I know a lady, and she had the breast cancer just removed, and they were doing radiations. And it was like about a year ago or something. And then I said, I better talk to her. How is she feeling? And so I called her, and she says, well, she's having a hard time with sleeping, and she's all kind of, her body's like upside down turned. She feels like urgent all the time, and that's kind of she feels. But the other thing is she's having a bone. This is what do you call that when they
Bone pain?
No pain. Just taking the calcium and
osteoporosis.
Osteoporosis progressive because of the radiation. So there is a side effects, obviously. They told me there is none. So there you go. But anyway, so I said to lady, let me just to the doctor oncologist in the Cross Cancer Institute in Edmonton here. I just said, why don't we do some more tests and see if this cancer is spreading or what exactly is going on? And she said, oh, that's okay. We can do some more tests. So she sent me for a bone scan, and she sent me for MRI for my liver, because that's what basically the cancer like to go, the breast cancer, and it came clean. But we were doing the
Vitamin C and
vitamin
ozone.
C and ozone in the same time, right? And so I don't know if she says, well, I don't see anything here, everything looks good. And so she says, well, I don't know what to say, but I will still recommend radiation in case. I'm like, what?
Preventative.
Why you want to kill me? Because what? So no. So
and they did an MRI, which
they
came
did
back,
an MRI, and
came back clear.
There was some spots on my liver, but after my diet and everything, they came clean.
The last MRI was
The
clear.
last MRI came clean.
Very good.
So that's what, that's what I finished with Cancer Institute, and we did with Dr. Botova, we did the blood work, and we did the stem cells, circulating stem cell test. I had to send it to US to have it done, because apparently they don't do it here. I don't understand why, but they don't do it here. And then it came negative.
Yep, it's normal. All the tumor markers are normal, so yeah.
So
really doing really well.
I just have to be on a diet. I introduce some meat now, but very slowly, like a broth. But I'm still juicing. I'm doing a lot of juicing, carrot juicing, and all the whatever we were doing the ketogenic diet. Ketogenic diet. So that's the one. And then. And then
We've really done about 4 months of IVs.
About
4 months. Yeah, so it
twice
didn't take long before things kind of went back to normal. Okay, that's exciting. Thank you for coming to share your story.
You're very welcome. Yeah.